My name is Dr. James, and today I'd like to share with you 12 key or main causes of swelling in the body. Which swelling in the body can be in your arms, but commonly in the peripheral area or the extremities, like your legs, your ankle, and sometimes in some serious cases, it can be in your lungs, or you can have fluid in your brain, or it can be in the belly. All these can be as a result of a specific cause. So there are causes for these symptoms. But how do you know that you have swelling? Somebody would say, if I have swollen leg, it's a swelling. Some individuals may not have the swollen legs at all, but they may have stretched or shiny skin, or they may have a dimple after applying a little bit pressure on the skin, or they may have some puffiness of the ankle or face or around the eyes. They may suddenly gain weight or lose weight, or they may have experienced decreased urine production or feeling of heaviness in the legs. So these are common signs to indicate that you have swellings. But what are the causes? I start with a mild case. When you're standing, maybe the job you're doing, you stand for too long or you sit for too long. If the valves in your veins are a bit kind of weak or damaged, normally you may have swelling because of that, because the veins are supposed to direct blood in one way direction back to the heart. So if you stand for too long and you have problem with the vein health, then of course normally you have this kind of swelling, which when you lift your up your legs in the evening or you sleep well in the night, the following day you will see that it's resolved. But it's important to strengthen the valves and strengthen the walls of your veins. Number two is too much salt. Salt is good, but it's important to eat it in moderation. Pregnancy, of course, with women during pregnancy, they produce more blood and fluid, so that can also contribute to swelling. The next is about swelling due to medications. There are some people on medications like blood pressure medication, or taking painkillers or steroids, or there's some women doing taking estrogen or hormonal therapy. And if you're diabetic and you take certain diabetic medication, that can also contribute to swelling. Or people that they may use certain drugs to treat nerve pain. And then also we have swelling due to medical condition or health condition. Normally it could be quite serious. And that number one can be congestive heart failure, that your heart is not strong enough to pump blood to meet the needs of the body. So normally you may have leg swelling, or you may have fluid in your lungs or in your belly when you have serious problem with the heart. Another organ that can be also contribute to swelling is liver damage. That's the liver cirrhosis. Kidney disease can contribute to swelling. Normally your legs and around the eyes. There's another cause. It's called deep vein thrombosis. That is suddenly there is swelling in one leg with pain in the calf muscle due to blood clot in one of the leg veins. And there's another cause here with the lymphatic system. This is a system which balances fluid in the body. So if there's a damage to it, or maybe a mass buildup or some tumor somewhere, it can also cause swelling. The last one, number 12, is malfunction of the sodium potassium pump in the cells. If you are lacking vitamin B1 and you have too much salt, it can cause this pump to malfunction and you can have swelling. If you have any kind of swelling, maybe there could be a disease behind. There's a call that you can make to resolve this. Give me a call on this number, +4 738 464 7300. Thank you very much for listening.